Garden is located on the corner of Southwest 27th Avenue and 34th Street.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Said something. All right, 4 minutes after 11 o'clock. Thank you for tuning in. We have bragged about Palm Garden forever, and it is a good reason for that. One of those reasons is Jan Marino. She's in the studio right now with Crystal. And Crystal, I don't know your last name.
Ash.
Ash, Crystal Ash.
Yes.
It's like a movie star name. And we're talking about some of the cool things you've done over at Palm Garden and your accolades with being best of the best. And there's a big sign behind you, so we're going to talk about that as well. Good morning, Crystal. Good morning, Jan.
Hi.
How are you?
How are you, Larry and Robin? We're glad to be back. It's been a long time.
So first, congratulations, best of the best. It's pretty good.
Third year in a row.
Wow.
Hey.
Wow, and you worked for that, too.
Yeah, we
Yes.
did.
Yeah, I mean, just showing up and people taking tours. Do you got a lot of people taking tours?
Not nearly enough.
Not enough, huh? We try to get people every day to come out there and take a tour.
I do too, and they recognize my voice a lot of times, but they don't necessarily take me up on the invitation to come tour.
And what do you think people mostly do? They wait till they absolutely need a place like Palm Garden before they take a tour?
I think so.
Yeah.
I think that people aren't going to be taking time out of their busy day to go look at some place that they don't need right now.
And they don't think they'll ever need.
Right.
Right, yeah.
Absolutely.
Yeah, I know, because I went through that myself with my own mom, that there was, we'll never need that, So it is nice to be prepared, and that's the main reason. So do you have any ways you're going to celebrate being best of the best? Are you going to pop open the old wine or something?
No. What can I say? We're putting it on a billboard so that Ocala can see it.
Okay.
We have put on a dandy new radio ad. Perhaps you've heard of WOCA, The Source. So we're doing that.
Uh-huh.
We have a little logo that we could put on the bottom of our emails when we send those out. We'll talk it up amongst our networking groups, but that's about it. Yeah, we're not having a festive little party in-house.
No, you should have something.
Well, we have Halloween.
Oh, would you have a Halloween party?
And a birthday coming up.
Yes,
Your birthday?
My birthday's on Wednesday.
Oh,
Yeah.
Ah.
Yeah. So we're celebrating that all week.
oh, there you go.
Okay, we're celebrating that all month. Yeah.
So, Crystal, what are you doing on Halloween? What's the party going to be? Is it for the public or just for the residents?
It's just going to be for the residents, and and also our employees and their children. So we have some people coming out. They're going to do a little costume contest, and
Oh, really?
What
are you going as?
A burglar.
Really?
Yes, for real.
How does a burglar look?
Well, I have a black, like toboggan or cap.
Oh, okay.
I have my
Okay.
black mask.
Yeah.
My black and white shirt. Black
Like you
pants.
broke out
And
of jail?
Yeah,
Okay.
and a bag of money.
Oh, nice.
Don't go to the convenience store before you get to work.
I know, right?
Don't do that. Or the bank.
Yeah, that wouldn't be a good thing, would it?
Don't go to those two places.
How did you prepare for the entry into the best of the best? How did you prepare for that? Because you just can't have your name on something without having a reputation before.
We did the advertising on the actual website where people could go in every day and vote for us. So we did go ahead and pay for the advertisement for that to remind people who we are. And Crystal and I are both very busy and involved in networking organizations out in the community between the CEP and two different BNI organizations and the case managers at the hospital and the doctors that we know and all of that. And so we just kind of asked people to vote for us if they felt so inclined,
And I
they
did.
did. Thank you.
And I did. I mean,
Yeah.
I went there, yeah.
Every day?
I don't know if I went every day, but I went there.
Good.
Yeah.
I didn't know you could go every day.
Every
every
day.
day.
Once
Oh.
a day, but every day.
Oh, okay.
Yeah, so August is a lot of work because we're not only voting for us, we're voting for our friends out there too.
Okay, okay.
And then it's my birthday month, so she's got a lot of work with that. too.
Oh, a lot of
nice.
August
A
is
happy
so
birthday.
busy.
So tell me about the sign behind you, Telehealth Solution. What is that?
You want to talk about that?
Yeah, so Palm Garden has teamed up with Telehealth Solutions, and basically what that means is that our guests and residents have availability to a physician 24 hours a day, 7 days a week. Although we have our physicians that take care of the guest in-house, sometimes after hours can be a challenge. Some of those physicians, they have their own practices. Also, families just get really anxious. And basically what this allows us to do, and we're the only ones in Marion County that has it, is it allows us to call in to a physician that has access to the medical record of that guest and basically provide care for them. They can, it does a lot of things. It's basically a video chat. So the nurse calls in, the physician answers. They can do a lot of different things, such as, check their blood pressure.
Wow.
And they can get the results for that. EKGs. They can, check their oxygen levels. There's a lot of things that are really involved in it.
But
And
you don't
it's-
do it by yourself. You have to have a nurse hooking you up to the stuff, right?
That's correct.
Yeah, okay.
Yeah, the nurse calls in, and basically, the physician answers.
Where's
and
the physician?
the physician? We have a few of them in Tampa. They're kind of throughout, the state of Florida.
So they're
that have-
at their end, they're at a computer with a camera, and they've got the information in front of them that is coming from the patient.
That's correct.
Wow.
What
Right.
telehealth is, which you can't really see in back of us on the little sign that we brought, it's a box, and it comes about chest high on me, about waist high on you. And there's on top of the whole thing is a screen and a camera. So
the
you
doctor can see you too.
Right. And
can see us and can see the guest, and we can meaning the nurse, can wheel it right into the guest's room, tip the little camera and say, oh, look at this. And the doctor can say, oh, that looks reddened. Oh, that looks very swollen. I'm going to order whatever. And he can order tests, he can order medication, and he or she, whatever the doctor is, can actually see the patient because we have rolled the doctor to the bedside.
Well, I got a funny idea for you.
Okay. I'll bet.
Look, put the camera, say, Doc, can you look at this for a second? And you know what? You put a piece of bologna under your garment.
Yeah.
And then just show the bologna. So look how easy this rips right here. And you
only you would do that.
oh, I would do that every day.
Yeah.
And the doctor,
If you rip the bologna and you put ketchup underneath,
Right.
Yeah,
Yeah,
there
I'm
you
saying.
go.
yeah. Or cotton. So pull out cotton. Just what is that?
So does this
I
take
know.
all the vital signs too in the machine? Like, can you take their blood pressure and everything, and then it automatically goes to the physician?
Yes.
Or, oh, I see. Oh, that's wonderful.
and we can use the doctor for easy things too, like checking lab results. And if a lab result was a stat, and so we need to know what's going on right now. We can talk to the doctor and say, okay, these are the lab results from this guest, and the doctor can say, okay, this is what you need to do.
So
Oh, okay.
this is at Palm Garden right now? This
Yeah.
Right
machine?
this minute.
Right.
How many are there? Just one?
Oh, yeah, in Palm Garden, there's only one, but because it's a machine on wheels,
You roll it
we can
around?
roll it anywhere we want
Right.
to.
Oh,
Yes.
really?
And we use it after hours, 7 p.m. to 7 a.m., so we can use it all night long.
Oh,
So
wow.
we don't have to wake up a doctor and wait for them to decide what they're going to do at 3 o'clock in the morning. We can use it all weekend long. And there's no limit to how much we can call this doc in a box and get answers right away, real time.
So is it always the same doctor? Or no?
I don't believe
No,
so.
I think there are a couple of rotating physicians
I see.
that.
I see. Wow.
So
that's
we'll be
pretty cool.
adding specialists. So if we need to talk to, a cardiologist or other specialty, those are going to be, next on the list that we're going to have as well.
Wow.
Yeah, because Palm Garden of Ocala, you also have skilled nursing
Right.
in your facility. So you do have all of the medical personnel there, except for the physician. So that way you do have everybody that's trained knows how to administer what if something needs to be done.
We have physicians that will visit, but you're right, we have nurses on staff in the building 24 hours a day, but there's nothing that we do that isn't following up on a doctor's order. So if that nurse needs to use this telehealth, to find out what the next step should be. And the nurse, of course, will also make recommendations. We are thinking we should be doing blah, blah, blah. Do you concur, doctor? And then the doctor can say yay or nay.
I'm assuming
Oh,
that the
wonderful.
doctor has your prescription information also?
Yeah,
So-
he has access to the
all that stuff-
electronic medical record. So he just pulls it up, goes right in, and he knows exactly everything that we have been doing for the guest or patient since they've been there.
Oh, wow. So
And,
I see you're taking, and he just fills it, whatever the vitamin is or whatever. I mean, does that
Right.
ever play a role, the things we prescribe ourselves, the vitamins and the herbal things like the GNC store in the mall? Does that need to be told to the doctor?
Yes.
Yes.
Yeah, I thought so.
Yep, if a person is on a multivitamin plus also, whatever supplements, that information comes to us right from the hospital, because the hospital's following that along as well.
Ah, okay.
And people, those things that are just over the counter and people think, it's just calcium. Anything can interact with anything else.
Sure.
Yeah.
And so then when the patients, when you have your patients come on board to Palm Garden of Ocala, they are aware that this telehealth solution does exist and that it's to their best benefit to participate in it. And the families are aware of that also.
Right.
Right.
Yep, because they know that we may be getting doctor's orders.
Emotional support is so important, and you guys do such a great job with that.
Oh, thanks.
So do the patients develop a relationship with the doctor on the screen?
I wouldn't think so. Would you think so?
I wouldn't think
You know
so.
what I mean? To the point where, let's say, I had a doctor and I liked the way he worked and the way he talked, and I say to you, hey, you got to bring that box in here. Can we get the same doctor again?
I wouldn't think so.
No?
Because it pretty much, I think, works on a rotating kind of a basis, and every time you call, you would get whoever's next in line. And I don't know how many doctors they may have covering any given period of time, but it's not really the kind of thing that we would be getting involved with, I don't think, on a personal level, so we know to ask for Dr. Larry or something.
Don't ask for him, because Mo and Shempa are going to be there too. You know the trouble that we get into. So.
I think this is great strides, because before you had to make a phone call and then you had to find a physician that was available and transport the patient to the physician. And this is really an amazing thing that you have come up with at Palm Garden.
It's new technology, and we're really excited to talk about it, Robin, because there is, at this point, nobody else in town who has this. And
Wow.
we use it a lot, and the nurses really like it. Makes their job easier, for one thing, because they don't have to bother and talk to doctors at 3 o'clock in the morning. They have a doc in the box that wants to talk to them.
It's already up at 3 o'clock in the morning.
That's right.
Correct.
Waiting for the call.
Look what he's doing to keep awake.
Yeah. Taking
Pacing.
calls.
Taking calls.
Right. Taking
Yep.
calls.
So are they servicing other hospitals in the nation or other facilities?
Sure.
Yes.
Yeah?
Yeah.
Wow. And they keep notes too. See, I would think if from the doctor's perspective, they might want to have the same patient so they could kind of follow along, no?
Apparently not.
Yeah.
It's sort of an emergent, kind of an urgent. It's not on a routine, chronic kind of basis.
Like an emergency room visit.
Well, yes.
Sort
I
of.
mean, obviously, it's not necessarily a big emergency. If it was a big emergency, we would send the resident or guest out to the hospital to be cared for and that sort of thing. But this can actually save some returns to the hospital when there is a physician who can find out what's going on right now and say, do this, so that we can start that IV or whatever it might happen to be, to save the poor guest from going back to the hospital when it doesn't have to happen.
Oh.
So one of the things we say in the morning when we talk about Palm Garden is those two words, skilled nursing.
Right.
I say them because I was told to say them. I don't really know what it means, though. What does that actually mean, skilled nursing?
Want to go? No? Okay. Skilled nursing is the kind of care that our guests get that could not be given by people like the four of us here.
Oh, definitely.
None of us are qualified to do any more than help with, we could maybe cook an egg or make a peanut butter sandwich or decide whether we want tartar sauce on our fish or something. That doesn't take,
You are right.
just saying. But the nurses.
And that peanut butter and jelly should be deep fried. We learned this in Macintosh.
Yeah.
Oh, deep fried.
Deep fried peanut butter and jelly.
Okay, so put
Yeah.
in egg and then or how do you deep fry it?
Well, you don't deep fry the egg. Although Robin had a Scottish egg that was deep fried.
Yeah, that was really
Yeah.
good.
So what is it, like a peanut butter and jelly, like Monte Cristo?
It's
Yeah,
probably about
exactly.
6,000
Yeah.
calories
Yeah.
is what I would say. I'm not sure.
Oh, might be the way to go.
Yeah, you probably would go.
But skilled nursing is the kind of care that only a nurse can give because they are trained to be able to do assessments. And they are the ones who can actually, call the doctor and decide what needs to be done. Like I said, they can offer suggestions to the doctor, but they're also the ones who are going to be providing that skilled wound care, for example. We're recently been named a center of excellence for our wound care because our nurse is that good with wounds. That's her specialty, if you will, and she knows how to take care of those wounds, and that's something that we don't know, because we're not nurses. We don't know how to
Wow,
do it
yeah,
ourselves.
yeah.
You wouldn't want me to start an IV. You don't want me to be doing the things that our nurses can do.
Right, and it's skilled care that they need more of than just, going home and having, a home health come a couple of days a week. It's like continuous, 24/7 care.
So we haven't been there in a while. Is there anything new to tell us about that one room you have with all that cool equipment, like the balancing thing and the big screen thing? Is there anything new in there?
No, not really. The balancing thing is Biodex, and that's a balancing thing. It's because we want to keep people from falling. And the big screen thing is it's never too late, and that's like an iPad on steroids. Looks like a lot of fun, is a lot of fun, but there's a purpose behind everything. And we still have the Alter G, which is the anti-gravity treadmill.
I love that one.
Yeah,
We still
it's
have all of
wonderful.
those things, yep. We give good old-fashioned care. Some of our therapists are trained to the doctorate level, so when a guest comes into Palm Garden, they are being followed by a variety of kinds of doctors. Doctors of different therapy, medical doctors. We have a physiatrist that we can use as a consultant. A physiatrist is a medical doctor.
Thank you for answering
Yeah.
the question I didn't ask.
Well, it's like psychiatrist. No, not a psychiatrist. A medical doctor whose specialty is rehabilitative medicine. So they can look and they can say, oh, you've just had your knee operated on, Robin. Let me see how that's healing. Oh, that looks good. You doesn't look like, you're not having any infection going on there. But how can you walk and how can you bend? So there's the rehabilitation part of it, but it's also the medical doctor part of it. So you can complain to him about your pain, and it's red and it's sore and, whatever.
And is some of that handled by the telehealth doctor?
It certainly can be.
Yeah?
Yeah, that's the beauty part of having the camera. Thank you.
Does the doctor ask the nurse to, as a second set of eyes, that's actually in the room, does that look infected to you? That kind of question. Would it, yeah?
I'm sure, right.
Yeah.
I would think so.
Yeah, it makes sense, yes.
Sure.
So there has to be another professional medical person in the room
Oh, absolutely.
with the...
Right, because he's going to say, does it, feel warm to touch? I mean, he certainly can't touch it, on
Right,
the
right,
screen.
right.
So there's certain things that he's going to look for.
Can he tell if you have a fever? Does he-
Well, I think as far as that the nurse would do that.
Just to, okay.
Do the vital signs.
Right.
And only a nurse can take an order from a doctor. The doctor can order me around all day long, but it isn't going to get me, I can't write down some prescription that this guest should have. I'm not a nurse. I can't take an order from a doctor.
Right.
So the telehealth is worked by a nurse in our center to a doctor.
And Palm Garden of Ocala has always been on the cutting edge of everything. You're always first with new technology. Now you're first with a telehealth. What kind of preparations did you have to do between the administration and the staff to say, okay, telehealth would be a good thing?
Well, there was a lot of data, that was collected as far as, just managing every day of saying, hey, when we have our guests and residents here at the facility, it hasn't been difficult to get, in touch with physicians after hours. What we found is that typically, although our physicians are wonderful and they provide great care, in the evening times or after hours when patients seem to get, more anxiety about, things that are going on with them, that the physicians, waiting for a physician to call you back, just made the patient have more anxiety. So we kind of looked at that picture. We looked at a lot of data of saying, hey, if we are more of a rapid response and we can get to things quicker, then typically our patients and guests, they don't go back to the hospital because they find that comfort of knowing that their questions were answered, that they have, everyone wants, if something's wrong with you, you want to know what it is, and you want to know what it is now, whether it's a red spot or whatever the case scenario is. So we looked at that. We looked at the different telehealth companies out there and wanted to look at their statistics of what kind of care that they've provided and how they've helped other companies as well. So we kind of looked at all of those things and, made the determination, to use the telehealth solution system.
And then what we did was we had an
Lots of
in-service,
in-service,
lots
right.
of in-services, so every nurse in the building knows how to walk through the process of doing the telehealth, and it's actually really easy. And there are also little cheat sheet reference cards that hang right on the top of the little handle that you use to push up and down the hallways, but there's a little cheat sheet reference cards so that people, if they need to refresh themselves, can easily do that.
Yeah, so the company came out and they did all of that training and in-servicing, and then they, they can provide that at any time. So if we have a new nurse or, that needs to learn about the equipment and wants, more information than our nurses, then they'll come back out and anything that we add to the machine as well.
Oh, that's wonderful.
Yeah.
Is the person at Palm Garden who is the respite person there? What does it actually mean before I ask the question? Because I don't want to sound too stupid. Respite means they're there for the day, but not overnight. Is that what a respite is?
No, close though. We don't do just a one-day thing.
Like a daycare.
Like a daycare. Respite would be giving a case manager, a caregiver at home, the ability to go on vacation from taking care of their loved one at home.
Okay.
Or maybe they need to go to Ohio to a wedding, but they can't bring their loved one with them because they're too sick. They would come into our center for just 4 days, 7 days, something like that. And whether we have availability for respite, it is a service that we offer from time to time. Folks who are at home on hospice, sometimes they don't meet criteria to go into a hospice house, but the caregiver just needs a break for a little while, and they can arrange for having that loved one come to our center for a little while.
Oh, my.
And the caregiver can be the wife, right? It doesn't have to be a professional.
Wouldn't be a professional.
It wouldn't be.
It would be
Okay.
somebody at home,
Okay.
whoever that is.
Okay.
Could be the son or the daughter.
Right, okay.
But if you are caring for somebody that needs you 24 hours a day, your day is going to be 36 hours long.
And is the respite guest, does all of the services of Palm Garden apply to them as well?
Sure.
Yes.
The activities, the telehealth and everything else, yeah?
Absolutely.
So the fun part, tell me about the food and the activities.
Want to talk about the food and the activities?
Well, we have fine dining, so that's a wonderful thing that we have at Palm Garden as far as all of our dining tables. We use the fine linen and china.
I know, it's
all
really
that kind of
beautiful.
stuff. We have a couple of different menus. We are known for not cooking from a can, so we use a lot of fresh vegetables and meats and different things like that, and we actually have a menu that they can kind of choose from, and a la carte menu as well. If some people just like to have hamburgers all the time.
That's me. That's gonna be me when I move in.
Right.
There you go.
I'll take a cheeseburger with a side of a cheeseburger.
That's right.
So we, provide a lot of different things. We also, as part of the activities, they have a food planning committee. So the residents and guests that are there,
really?
mostly the residents, take part in the food committee, and they say, hey, this is what we're thinking. So they usually, look at the menus, they do the help with some of the meal planning, to determine what it is that they want to eat. It's important for them to be involved. As far as the...
Talk about date night.
Oh, date night. We have date night.
I want to hear about that. Date night.
Yeah, I thought.
So what we do on date night, basically, is that our short-term guests, typically when a short-term guest comes into our center, they've been away from their loved one, whether it's their spouse, whether, it may be their child that's been caring for them at home. Basically, what we do is we try to rekindle and put together kind of like a candlelight dinner where they get to choose the menu, and we bring flowers and we kind of have something special for them because, if you've been a resident, you've had a hospital stay, you've been there for a week, you come to Palm Garden, you've been there for 2 weeks. Well, now it's, 3 weeks you've been away from each other. And some of these couples, they've been married 60 plus years.
Yeah,
they've never
yeah.
spent a minute apart until the sickness or whatever happened to, bring them in for rehabilitation.
Right.
So we try to do something special for them. Something else that we're getting ready to do is we're going to have some specialty dinners where farm to table. So we're going to have some guests and their families, kind of have special meals. So that's what's coming up, and we're going to start in November doing that.
Oh, nice.
wasn't paying attention.
and that's one of the other reasons that you're best of the best, Jan.
Aw.
You, the staff, everybody there, all of the behind the scenes people, because it takes a whole entity to really have a good I don't want to say product because it's not really a product. Palm Garden really makes people feel like they are home.
Yeah. Well, and Crystal and I are definitely the mouth of Palm Garden, and we are telling people about it. But let's face it, we're not caring for those guests and residents every day. That's our nurses, that's our activities, our therapists, our housekeepers, our dietary, and everybody plays a part.
Mm-hmm.
We can't do without any of them. So.
Well, we're proud to have you on board with the lineup here at WOCA, so thank you for doing that. Do you want to give the nuts and bolts? How do we get to where you are? What's your
Sure.
phone number?
We're on the corner of Southwest 27th Avenue and 34th Street, and our number is area code 352-854-6262. Again, that's 854-6262. And if you would like to take the tour that we're always asking you to do, you don't have to have an appointment. Just stop in and say, I'd like to take a tour. And either Crystal or I or somebody else will be more than happy to brag about the work we do at Palm Garden.
PalmGardenofOcala.com is the website.
PalmGardenofOcala.com.
Very good.
Yes.
Jan and Crystal, thank you, ladies.
Thanks, Larry and Robin.
Don't eat too much candy.
Okay.
Oh, go ahead.
Oh, all
And
right.
congratulations on being the best of the best, because Palm Garden of Ocala truly is.
Thank you so much.
Very good. We'll be right back. This is The Source, WOCA Ocala.
Here is your one-minute news brief. A 57-year-old landlord in Ocala has been charged with second-degree murder after he shot and killed one of his tenants. The human remains recovered from the yard of a St. Cloud home